Hello and welcome to Pregnancy Info. Miscarriages can be emotionally distressing and are undoubtedly difficult to deal with. Pregnancy loss before 20 weeks is referred to as a miscarriage, as sometimes babies do not develop enough to survive. You are not the mere person facing miscarriages, but there are many women experience this devastating hap. You may feel like it's your fault when you miscarry baby. However, just don't blame yourself, as there are many factors that can lead to miscarriage that are not in your control. Miscarriage can be the result of chromosomal abnormalities, hormonal imbalance, infection, medical condition, some unforeseen cases. You may not know the reason. Sometimes that does not necessarily mean that you have done anything wrong. The most important thing is you need to take care of yourself and certain things after miscarriage to avoid complications in future pregnancy. People often have some illusions and myths regarding miscarriages. Some are explained in this video for your convenience. Number 1. Miscarriage is something to be ashamed of. I think one of the reasons why we don't talk about miscarriage is because we are ashamed of it. We believe that our body failed us and it makes us less of a woman. After all, our bodies were designed for reproduction. However, a failed pregnancy can trigger insecurities over your worthiness. Number 2. Vaccinations cause miscarriages. This is another big number. No vaccine cause miscarriages, and the science proves this. Still, some people think that vaccination can cause miscarriages. Next, using birth control prior to pregnancy causes miscarriage. Again, what does cause a miscarriage is generally out of a person's control, so it is also a myth about birth control medicines. Next, miscarriage is hereditary. The reason for miscarriage differ from person to person. Having miscarriage in other family members can be a pure coincidence. It is a misconception that miscarriage is hereditary. It is important to remember that each pregnancy is unique and the chances of a successful pregnancy after a previous miscarriage are generally high. All women grieve their miscarriage. Every woman has her own unique response to miscarriage. Some grieve the loss as the death of a child. Others see the loss more like a missed opportunity. The same woman may experience the loss differently at different times in her lifespan, depending on her financial circumstances, age, and how many children she already has. Miscarriage can be a result of stress. Some expectant mothers go so far as to steer clear of funerals and distressing events. However, common distresses like traffic on the way to work, a quarrel with your spouse, or unforeseen cost won't hurt your child. However, chronic stress such as the kind brought on by living in poverty or in an abusive environment can have a negative impact on your health and raise the chance of miscarriage. You can't conceive before 3 months after miscarriage. People often mislead the duration of trying to get pregnant after having miscarriage. Well, the truth is dependent on various factors like when you are ready mentally, physically to get pregnant, because it is crucial that you are well over pregnancy loss, sadness before trying for your next pregnancy, and your body is now ready to carry a baby. Bleeding or spotting during pregnancy is always a sign of miscarriage. Vaginal spotting or bleeding is a common thing in the first trimester during pregnancy. Apart from that, heavy or prolonged bleeding can also occur even if you have healthy pregnancy. So it is just a myth. Bleeding or spotting are not always a sign of miscarriage. There are no ways to stop miscarriages. As discussed before, there are few ways to prevent miscarriages. You can prevent it through switching to a healthy lifestyle, avoid smoking, alcohol, junk foods, drugs, etc. By doing mild to moderate workout on a daily basis, yoga and meditation can also help in keeping your body healthy and reduce the chances of miscarriage. Miscarriage is uncommon. This is the biggest myth, as miscarriages are not very rare. There are 10 to 20% pregnancy which end up in miscarriages. Pregnancy loss can be prevented through various safety measures, but nowadays due to extreme carelessness, and underlying medical conditions, the rate of miscarriage is rising. Miscarriages are always accompanied by intense pain and heavy bleeding. While most miscarriages involve some degree of cramping and pain, this varies drastically from person to person. Some women will experience intense pain while others will have very light cramps or no warning signs at all. Having one miscarriage means you are bound to have another. Pregnancy after loss can be anxiety provoking, but the good news is only 1 to 2% of women will experience recurrent miscarriage, defined as having 2 or more pregnancy losses. So if you have suffered a miscarriage, chances are high that you will go on to have a healthy subsequent pregnancy. You caused your miscarriage. While a miscarriage may have happened to you, it certainly didn't happen because of you. In fact, the most common cause of first trimester pregnancy loss is chromosomal abnormalities in the embryo. This means there were either too many or too fewer chromosomes in the developing embryo, most often due to random errors as the embryo begins to grow and divide, not because of you or your partner. So, this is all about the myths related to miscarriage. Hope I have explained well, and share this information with the female who are suffering miscarriage and they want to know about the realities, facts and myths about pregnancy and miscarriages. Thank you.